For speaking to the bill.
Gentleman has floor.
Thank you, Mr. Speaker. There's a reason why we have committees to deal with very complex issues, and we shouldn't do it on the House floor. Now, I've taken the time to read through the substitute. It tries to fix the most controversial issue. It tries to fix an issue I've raised on this floor, but in doing so, it doesn't, not only does it not fix it, it makes it worse. If you look at Section B, line 20, or starting at line 18, at least 24 hours before the performance of an abortion, a qualified medical professional shall perform fetal transabdominal ultrasound imaging. What you have done is mandated for any abortion done early in a pregnancy an ultrasound that will be utterly useless. Remember how we got in the mess to begin with. It was because when legislators wrote a bill, they didn't understand the medicine. Early in a pregnancy, the reason a transvaginal ultrasound is done is because if you do transabdominal, all you will see is muscle. So by saying you shall perform fetal transabdominal ultrasound, first, you're mandating not only a completely unnecessary procedure, but a useless one. And then that doctor can offer the transvaginal, and the woman can say no. But one of the questions that's raised, and I don't think this substitute answer is, does the same doctor who performs the abortion, which is the one required to provide informed consent, does that mean it has to be the same doctor that does the ultrasound? When I got pregnant and went to my ultrasounds, a different doctor performed it. Not even part of the same practice, so that doctor wasn't an agent of mine. This bill has tried to fix the miscarriage incidences, but it doesn't, and it makes it worse. On lines 88 and 89, the physician need not obtain the informed written consent of the woman when the abortion is to be performed pursuant to a medical emergency or spontaneous miscarriage. Words have meaning. And when courts interpret our statutes, they assume we know what we're doing when we pick those words. I have a book here, What to Expect When You're Expecting. It was the first book I bought. And the gentleman from Rockbridge is shaking his head because his is probably a little more up to date than mine. On the back, it says, The American Pregnancy Bible, written by Dr. Heidi Murkoff in conjunction with several other OBGYNs. They have a whole chapter on managing a complicated pregnancy. And the first part asks, or talks about, different types of miscarriages. Early miscarriage, known in medical speak as spontaneous abortion, is the spontaneous expulsion of an embryo or fetus from the uterus before the fetus is able to live on the outside, or in other words, the unplanned end of a pregnancy. Now, I know you don't really want to get graphic here, but let me tell you what we're talking about. That's what you think of when the fetus and the placenta are expelled totally from the uterus. Lots of blood. Happens early in the pregnancy, and probably 80% of miscarriages are spontaneous. I never claimed that any version of this bill applied to those. You've excluded those, but here's what you haven't excluded. Missed miscarriage. A missed miscarriage is when the embryo or fetus dies but continues to stay in the uterus. Often the only signs are the loss of pregnancy symptoms, and there's no fetal heartbeat. So part of what's in the uterus is expelled, but not everything. Well, guess what you have to do to completely clear out the uterus? You have to have an abortion. There's a third type of miscarriage. Incomplete miscarriage is when some of the tissue from the placenta stays inside the uterus and some is passed through the vagina via bleeding. In that miscarriage, guess what you have to do to complete it? You have to have an abortion. By specifically inserting an exception for a spontaneous miscarriage, you've excluded from the ultrasound bill the very miscarriages that don't require an abortion. By definition, you are requiring an ultrasound for the miscarriages that do. Words matter. Here's what else you've done. This bill still, while it makes an exception in the case of a medical emergency abortion, it doesn't cover the abortions we talked about in House Bill 62. It doesn't solve the problem that would have been faced by a woman who sent me her story, where on January 13th of this year, despite all previous tests being negative, she learned that her baby had one of the most severe forms of spina bifida her doctor had ever seen. And I'll spare you some of the details she put in her email. But the doctor suspected her baby was paralyzed from the waist down. The paralysis would advance up his back as he grew. She went to some of the best doctors in the world, and it became clear to her that her baby didn't have a chance. And these are her words. Despite my husband and I really wanting this baby, our first, we decided to terminate. We chose this path because it was best for him. I could not bring him here to the world only to suffer. On Monday, January 23rd, we delivered at 23 weeks our son via D&E, which is an abortion. I was an emotional wreck. I could not believe this was happening to us. I have no idea how I would make it through, but I figured telling my story was a start. Now, in the context of, she was writing in the context of House Bill 62, but I think her words ring just as true for this. By law, this bill, even in the substitute, would require her to have an ultrasound within 24 hours of her abortion. Within 2 hours if she lived outside of 100 miles. By law, her doctor would be required to ask her if she wants to see it. By law, her doctor would be required to ask if she wants to listen to the fetal heartbeat. I got many more stories just as sad that this bill would apply to. This bill would apply to abortions that were the result of rape and incest. And I know many of you are thinking, because some of you have said it to me before, well, Delegate McClellan, you only talk about the tragic cases. That's exactly right. I am compelled to do it. Because many of these women who have faced horrific decisions, whether it's the one I just read or the woman who has a baby, has a pregnancy, and has to decide whether or not to terminate because it's not a medical emergency, but if she carries it to term, it could kill her because she has to choose between life-saving cancer treatments or carrying the baby to term, or she has to choose between putting her life at risk because she has a hole in her heart and got pregnant. If she carries the baby to term, she could die. These are not decisions that are made lightly. These are agonizing decisions that are between the mother, the father, if he's around, their doctor, and their God. And government has no place inserting itself in that decision and mandating what her doctor will or will not do. And the difference, gentleman from Prince William has said, and I'm sure will say again, well, we're just codifying what is Planned Parenthood's normal operating procedure. Not every abortion is done in Planned Parenthood in the first 20 weeks of pregnancy. And the difference is when those procedures are done, it is because the doctor feels it is necessary and in the best interest of the patient. It is not because people in the General Assembly who don't have a medical degree have decided for them. Yes, I talk about the tragic cases. Somebody's got to, because we don't just legislate the stereotype. And we heard on this floor what the stereotype was. We don't just legislate the stereotype. Our laws apply to every case. This law applies to every case. And while I appreciate the attempts to fix it, we haven't. For that reason, I ask that you vote against this substitute and vote against the bill.
Mr. Speaker.